we presented top-line overall survival data, but we also presented demographics as well as a safety profile. So safety population for this trial included 73 patients. And if you look at the demographics, overall, this was highly representative of a metastatic non-small cell lung cancer population with a median age of 67 years, as well as most of these patients were men, about 56%. One key factor for this population was high rates of patients with PD-L1 negativity, 48% having less than 1% expression. Most common treatment-related AEs occurring in more than 5% of the patients were also reported. And we found that most of the adverse events were actually grade 1 and 2. Grade 3 TRAEs were actually seen in less than 10% of the patients. There were no DLTs reported. And in general, any of the AEs that were reported were consistent with the mechanism of action, that is chills and pyrexia. In terms of overall survival results, we found that there were several patients who were long-term survivors after CAN-2409 treatment. So firstly, let's talk about response rates. So most patients were actually enrolled in cohort 2, that is, they had clinical evidence of progressive disease along with radiographic evidence despite immune checkpoint inhibition. And in this cohort 2, we found that the overall response rate was 8% and the disease control rate was 70%. In cohort 1, patients who had stable disease and then were entered onto this clinical trial, we found an overall response rate of 40% with a disease control rate of 100%. For both cohorts combined, median overall survival was 22 months after CAN-2409 treatment. However, if we just look at cohort 2, now again, these are our true second-line patients who have progressive disease after first-line checkpoint blockade, we found that the median overall survival was 20.6 months after 2409 treatment, compared to historical standards, which is usually less than 12 months, averaging about 9 to 11 months.
Great.